The Lowe's Hole Hospital does 6,500 procedures per year in the women's operating room and has 6 operating rooms, 4 for gynecology and 2 for obstetrics.
Our focus this year in obtaining community support is to develop and implement an additional theatre for minor procedures. Well, we have capacity now for operating room procedures, and we do our very best and work very hard to ensure that patients are getting in within acceptable timeframes. The opportunity to create and maintain an outpatient procedure room really will make a huge difference in allowing us to focus on patient flow and encourage that the patients most at risk will receive care in a timely way and increase capacity for patients requiring both really minor and very complex surgeries and cesarean sections in our hospital.
Having a dedicated outpatient operating room, we can expect to be able to help over 1,000 patients get their procedure in a more timely manner. They will undergo a procedural sedation instead of a general anesthetic, which means they will recover much quicker and be back to their families and their lives, which, as we all know, is an excellent thing for our patients.
About 10 years ago, I was pregnant with my son, Cordell, and at that time I was in a pretty sticky situation. I had been evicted from my place and I didn't have anywhere to go. I was scared. I was scared to access services. I was scared to access prenatal care. I had never been pregnant before. I had never seen a prenatal doctor before. And I was so scared to go into these places and say, I don't have a place to live right now. When you don't have an address to put down, it's embarrassing, it's scary. You know it's gonna raise a red flag. I had to go to many different agencies and service providers and tell my story over and over again. And it was traumatizing and it was degrading to me as a human being.
Why should a woman have to ask 1,000,000 times and tell her story 1,000,000 times to achieve some change for her life, for her infant? 5 years ago, Pregnancy Pathways started without a name, but with the knowledge that there was the problem of pregnant homeless women.
I was out with one of my outreach nurses, and we walked just a few feet down into the river valley, and there was a tent there with a pregnant woman, and that was the moment I think that I decided that that was unacceptable and we needed to do something about this. We've learned that there are at least 100 women who are pregnant and deliver while living on the street every year. So Pregnancy Pathways is hoping to provide services to those women.
I needed to find a safe living situation. I needed to learn financial literacy. I needed to get an education. And most importantly, I needed to learn how to parent in a healthy way, in a way that was going to benefit the both of us and that was going to ensure that he had a good childhood. That was my main goal. I wanted my son to have a good life.
So Pregnancy Pathways is hoping to provide housing to start with, and also to provide appropriate linkages to health services, including prenatal care, mental health and addiction services, and then of course to provide follow-up health services for the infant and any cultural supports that may be necessary can be provided.
There are so many women in this city that are slipping through the cracks that might want that help, but they don't know how to access the resources. They don't know how to get that help.
There are those people out there who desperately need help to get to better circumstance. They can't do it alone, and we can't, as professionals, do it for them. We need the community behind us with support, with volunteerism, and with gifts of cash.
Although we've had a lot of funding and support from governmental and non-governmental agencies, private donor support has been essential in meeting our minimum budget to get Pregnancy Pathways up and running.
Pregnancy Pathways is such an important program because we need to erase the stigma around women who are facing barriers to parenting so that we can support them to get to where they want to be as parents, as women. 10 years ago, somebody might have looked at me and said, this woman can't do that. But here he is, he's doing it, he's happy, he's healthy, I'm doing it, and we're doing it together. You know, it means so much to me just to know that there are people that care. And it means a lot to me to know that there are women that are going to feel supported. Every day I wake up and I'm so thankful that I had an opportunity to parent. I'm so thankful that that wasn't taken from me.